our new progressive care unit, and this is PCU South. We've got PCU East and West, and this is PCU South. We have nice new head walls that I don't know that any other hospitals have. We have our rounding boards, which is really nice for doing hourly rounding and for including important information for our patients, which would include the physician, the nurse, the CNA, my name and number, which is the director, and then we want the patients to be educated on their plan of care, so we make sure that we put that on there. And then every hour we actually come in and talk with the patient, ask if they have any needs, pain needs, or anything like that. And we also have, please remind us to always wash our hands. You know, infection is huge, and so we wanted to put all this stuff on here to help the patients, help us to help them. So we have the bathrooms are also completely redone. We have some nice big showers, and then the seating here for safety for the patients. The control here certainly for if they get into any trouble. Again, all of our rooms are private rooms over here. This is a 32-bed unit, so we will be able to house 32 patients, and all of them in the private rooms. So this is going to be really nice. And if families need to stay, the class will be nice for that, to be able to accommodate that. We have the flat screen TVs, which are a nice little bonus. Yeah. Which will maintain a negative pressure at all times, so that when we have patients that are on isolation for certain infections, it's going to be this type of room. As you can see, this room is missing the sink because it is out here. All of the equipment that we would need to get is right at the entrance of the hallway here. The ceilings are different from the other rooms. Again, everything in here has to maintain this negative pressure, this type of an environment, so that the air is filtered out of the building instead of in the normal air conditioning system. So it's really a really nice room. We have 3 of these negative pressure rooms, and you hear the beeping that's going on. It's because we've taken away that negative pressure in this room. So it's it's got the normal.
These rooms are basically like the ones you just seen, so unless you watch it, you know you walk up and down. Every single bed, every 32 beds, all private.
This is our medication room. We have Pyxis is our medication dispensing system, and the nurses have to have a unique ID to be able to come in and actually pull up medications, and again that helps us to control narcotics and patient medications and charges and things like that. So this is our Pyxis. These are towers that go along with the Pyxis for extra things, medications, IV fluids, and different things like that, tubing. This is the refrigerator. There's some medications that have to be refrigerated, and it too, as you can see, works off of the Pyxis. The nurse goes in and types in for the medication, and then we get it out of the refrigerator. We have a good communication system here. We leave little notes and stuff, or this is another spot where we're going to put notices to the nurses and memos and things like that. This area is actually going to have pegs so that we can hang the patient's IV antibiotics that are in little bags and things like that on a pegboard system with the patient's number. So everything's very nicely organized. We have the cabinets for syringes and extra supplies and things in here, and of course the sink so they can wash their hands. Joint Commission does require a designated area if we're going to mix medications, if we ever have to do that. So we'll have this area here where you're uninterrupted and the nurses can come and mix medications if they need to.